You know that little ache, that stubborn stiffness that greets you first thing, especially in your hands? Most of us just let out a little sigh, shrug it off, and think, just another sign of getting older. It's so easy to overlook those quiet nudges. But sometimes your hands and fingers are actually trying to tell you something incredibly important, something far more significant than just the passage of time. They might be whispering about rheumatoid arthritis. And trust me, you absolutely need to lean in and listen closely, because catching RA early changes everything, truly everything. We're not talking about a small inconvenience. We're talking about preventing serious, life-altering problems down the road. Imagine keeping your hands strong, flexible, and pain-free for years to come. That's the immense power that comes with early detection. So stay with me. I'm going to reveal 7 subtle, often missed signals your hands might be sending, signs that could point directly to early rheumatoid arthritis. These aren't the obvious, painful twists you might picture later on with severe arthritis. No, these are the gentle hints, the quiet warnings your body offers. Let's really tune in to what your hands are trying to communicate. Let's clear the air and skip the complicated medical language for a moment. Picture rheumatoid arthritis as your body's own defense system, your immune system, suddenly getting its wires crossed. Instead of diligently fighting off unwelcome invaders like germs, it mistakenly starts attacking the healthy lining of your own joints. It's not the same as wear and tear that leads to common osteoarthritis. This condition operates on a completely different principle. And here's the kicker. It often sets up shop in your hands and fingers first. These tiny, intricate joints are delicate marvels. They are the instruments that allow you to deftly button a shirt, tenderly hold a grandchild's hand, or simply twist open a jar. Ignoring those initial whispers, those first signs, can lead to permanent damage in these crucial tools. Just imagine how frustrating it would be if simple, everyday tasks suddenly became incredibly difficult or even impossible. That's the very risk we're talking about. But here's the truly empowering part, the hopeful message. Taking action early can dramatically slow RA's progression. In many cases, it can even bring it to a screeching halt before significant, irreversible damage occurs. This means you can keep your hands working, maintain your independence, and continue to do all the things you cherish. This conversation isn't meant to instill fear. It's designed to give you power, the power to understand and the power to take control. Your hands are far too valuable to ignore. Let's jump right into the first clue your hands might offer. Everyone feels a bit stiff when they first roll out of bed, right? A little creaky, maybe a few pops. But with rheumatoid arthritis, it's a distinct kind of stuck. Your hands might feel as if they're encased in tight, invisible gloves. It's not a vague stiffness across your whole body. It often zeroes in on the knuckles of your fingers, or where your fingers meet your hand. You might even find a struggle to make a full, firm fist. The real giveaway here, the crucial detail, is how long this particular stiffness hangs around. It doesn't just melt away after a few minutes of moving about. Oh no! This RA-related stiffness can cling on for an hour, sometimes even longer. Think about your morning routine. You get up, pour coffee, maybe get dressed. Are your hands still feeling like rusty hinges an hour or more after you've been up and active? That prolonged tightness is due to the inflammation needing time to subside. Imagine trying to button a small shirt, say 45 minutes after waking, and your fingers simply refuse to cooperate like they used to, feeling clumsy and unwilling to bend. It's incredibly frustrating. That lingering, unyielding stiffness is a significant early warning signal. Pay sharp attention to precisely how long that morning stiffness truly lasts. You could even set a mental timer. If it consistently stretches beyond an hour, it's a detail worth mentioning to your doctor. Now, let's turn our attention to the second telling sign, a kind of pain that just doesn't make any sense. We're all familiar with aches from a little too much gardening or a long session typing, but this isn't that. This particular pain often decides to pop up even when you haven't put your hands through anything strenuous at all. It's a persistent throbbing, an aching, or sometimes even a burning sensation that really focuses on your small finger joints, specifically the knuckles closest to your palm or the middle knuckles of your fingers. What's truly distinctive is that this discomfort can feel worse at rest. You might be sitting peacefully, absorbed in a book, or just relaxing, and these joints simply start to throb. It's not pain triggered by movement, it's pain directly stemming from the active inflammation within the joint itself. Gently press on those knuckles. Does it feel tender? Even a light touch can bring a sharp sting. Consider this. You reach for a paperback book and your knuckle joints feel tender, even though you haven't lifted anything heavy all day. The pain isn't a result of effort, it's just there. This unique rest ache is a subtle but incredibly important hint that something deeper might be unfolding within your joints. Try. Become a detective of your own hand pain. Is it strictly tied to activity, or does it also make an appearance when you're simply relaxing? Keeping a mental record of these patterns can be very helpful. The third clue is something you might actually see or feel: knuckles that look or feel puffy and warm. Take a careful look at your hands, focusing especially on the knuckles where your fingers meet your hand, the big ones, or the middle knuckles of your fingers. Do they appear a bit swollen, almost like tiny, slightly plump sausages? This isn't the general bloat you might get after a salty meal. This is a persistent, localized swelling that sticks around. Sometimes these swollen joints might also feel distinctly warm to the touch. Gently place the back of your hand against them, then against the skin just next to them. Does that particular knuckle feel noticeably warmer? This isn't merely a cosmetic change. It's a clear indication of inflammation, which is the hallmark of RA activity. That warmth means increased blood flow is rushing to the area as your immune system works overtime, mistakenly attacking that joint. For instance, your favorite ring suddenly feels much tighter on a specific finger, even though your weight hasn't budged an ounce. It's not your whole hand swelling, it's often concentrated right on a particular knuckle or two. Try. Make it a habit to glance at your knuckles. Compare them from one hand to the other. Look for any subtle puffiness or gently feel for warmth that seems out of place on a specific joint. Now for a really big clue, a true hallmark that often points directly to rheumatoid arthritis: the mirror effect, or what I like to call symmetrical surprises. Unlike other types of arthritis that might just pick on one side of your body, RA often plays a very unfair game by affecting both sides. What exactly does that mean? Well, if your left pointer finger knuckle is giving you trouble, if it's sore, swollen, or stiff, then take a close look at your right pointer finger knuckle. Is it also showing similar signs? It's usually not perfectly identical, but typically, if a joint on one hand is involved, the very same joint on the other hand will also begin to show symptoms. This symmetry is a powerful signal that suggests it might indeed be RA, rather than just an isolated injury or a random ache in one hand. It's like your body is laying out a matching set of clues, highlighting the systemic nature of the condition. For example, you might find yourself struggling to open a stubborn jar with your right hand due to pain in your middle knuckles, and then you notice your left hand's matching middle knuckles feel just as achy, even if you haven't really used that hand much. The moment you notice a painful or stiff joint on one hand, immediately check the exact same joint on your other hand. This simple, mindful comparison can be incredibly revealing. Let's move on to the fifth indicator, a feeling of losing your grip, both literally and in terms of dexterity. Are everyday tasks suddenly becoming tougher than they used to be? Things like unfastening a tricky bottle cap, turning a stubborn doorknob, or even just twisting the top off a toothpaste. Your overall hand strength might feel noticeably weaker, or you might find yourself accidentally dropping things more often than before, seemingly for no good reason. Beyond just weakness, you might notice your movement is restricted. Trying to fully spread your fingers wide apart or making a really tight, complete fist could become difficult or outright painful. It feels as if your fingers simply won't obey or go where you want them to go. This isn't merely a lack of muscle power. It's the inflammation within the joint itself, making any movement painful and physically limiting its range. The swelling and tenderness literally get in the way of smooth function. Picture this. You're struggling to pick up a small coin from a flat surface because your fingers don't quite bend or grip with the precision they once had. That delicate fine motor control, that natural dexterity, feels compromised. Pay close attention to tasks that were once second nature. If opening a new bag of snacks or inserting a key into a lock feels like an unexpected battle, make a mental note of it. For our sixth clue, we're looking for subtle changes in your fingers that go beyond just obvious swelling. We're not talking about fingers that are dramatically twisted or deformed just yet. Think really gentle, almost imperceptible shifts. You might start to notice that one or more of your fingers feels slightly off in its alignment. Perhaps it looks like it's not quite perfectly straight anymore, even if it's just a tiny lean or a slight drift to one side. It's a very mild, almost secretive change at first. Sometimes, small, firm lumps can begin to appear just beneath the skin, often near a knuckle or on the back of your hand. These are known as rheumatoid nodules. They're typically not painful themselves, but they are a physical manifestation of RA activity, little collections of inflammatory tissue. They can range from the size of a pea to something a bit larger. It's important not to dismiss them as just regular bumps or calluses. These subtle physical changes are early warnings, not just cosmetic quirks. They signal that your body is undergoing internal shifts because the inflammation is actively starting to impact the structure of your joints. For instance, if you lay your hands flat on a table, you might notice one finger seems to slightly drift or curve inward more than its counterpart on the other hand. It's a small deviation, but it's there, and it's your body giving you a heads up. Try. Gently trace your fingers over your knuckles and the back of your hands. Feel carefully for any new, firm bumps that simply weren't there before. Our seventh clue often goes unnoticed because it feels so common, a persistent, overwhelming fatigue. But this isn't just the "I'm tired after a busy day" kind of tired. Oh no, this is a deep, bone-weary exhaustion that seems to seep right into your core, and even a full night's sleep doesn't seem to touch it. You might wake up feeling utterly drained, as if your body has been running a marathon all night long without you even moving. This profound fatigue isn't merely a side effect of pain or poor sleep, although those can certainly contribute. It's actually a direct symptom of the active inflammation raging inside your body due to RA. Your immune system is constantly working overtime, fighting a battle against itself, and that relentless internal struggle consumes a tremendous amount of your energy. This type of fatigue can ebb and flow, with some days feeling a bit better, but when it truly hits, it impacts your ability to carry out even simple daily activities. You might find yourself desperately needing to nap midday, even when your schedule wasn't particularly strenuous, feeling a profound drain on your energy reserves that you just can't shake. If this kind of unexplained, deep exhaustion sounds familiar, it's definitely worth noting. Try. For a few days, keep a mental tally of your energy levels. Pay attention if you feel unusually, deeply tired, especially when you've had what should have been adequate rest. So, we've carefully explored these 7 subtle signs your hands might be showing you. If any of them resonate, if you found yourself nodding along, please don't hesitate. Your hands and your ability to live freely in the years ahead truly depend on taking action. Hearing about a potential diagnosis isn't about simply getting a label. It's actually about unlocking the door to effective treatments that can genuinely protect your joints from irreversible damage. Modern medicine for rheumatoid arthritis has made incredible strides. We now have powerful tools, medications that can dramatically slow down the disease, often bring it to a halt, and prevent the severe permanent damage we used to see. But here's the critical point. These tools work best, most effectively, when they're put to use early in the disease process. Your most important next move is simple yet absolutely crucial. Have a frank conversation with your doctor. Be specific about everything you've noticed. Don't just say, "My hands hurt." Instead, use the exact language we've discussed. Mention persistent morning stiffness lasting over an hour, pain that occurs even at rest, or symmetrical swelling or tenderness in my knuckles. These precise details give your doctor the clearest picture they need to guide your next steps and explore the right path forward. Try. Before your doctor's visit, jot down which of these symptoms you've observed, on which specific joints, and for how long. Having this clear, organized list will help your doctor immensely and make your appointment much more productive. All right, so whether you're just beginning to suspect RA or you've already received a diagnosis, remember this. It's not about simply just dealing with it. It's about adopting smart, high-leverage strategies to keep your hands working well and to minimize any discomfort. Clever tip 1, power grips, not pinches. Try to avoid any sustained, tight pinching using just your fingertips. This puts immense, concentrated strain on those small, delicate joints. Instead, aim to use your whole hand or seek out tools with larger, more ergonomic grips. For example, when opening a stubborn jar, instead of pinching a tiny lid, use a jar opener with a wide, soft handle to distribute the pressure across your entire palm and fingers. Clever tip 2, your hands need a warm-up too. Just like any other part of your body before exercise, your hands really benefit from a gentle warm-up before you ask them to do heavy work. A warm compress for a few minutes, or even just rubbing your hands together slowly and mindfully can increase blood flow and ease stiffness before you tackle a more demanding task, like wrestling with a stiff lid. Clever tip 3, embrace the rest reset. Don't try to push through deep aching pain. If your hands are feeling particularly inflamed or flaring up, make sure to give them short, frequent breaks. Even just 5 minutes of stillness, letting your hands relax completely, can help calm down that inflammation and prevent you from overdoing it. Learn to truly listen to your body's signals. Clever tip 4, gentle, mindful hand movements, low impact. Think soft, slow, deliberate stretches. Gently opening and closing your hand, slowly curling your fingers into a loose fist, or subtle, smooth wrist rotations. These kinds of movements help keep the joints mobile without adding undue stress. Always stop if you feel any pain. And a reminder, talk to a clinician if you have heart, balance, or joint issues that persist or worsen. For instance, when opening a tricky Ziploc bag, instead of using just your thumb and pointer finger to pinch, use both hands and your full fingers for a broader, less strenuous grip that distributes the effort. Try. Take a look around your kitchen or workspace. Can you spot any tools that have thin handles? Even wrapping a bit of athletic tape or foam around a thin handle can create a fatter, easier to grip surface, making tasks much less stressful on your joints. Understanding these signs isn't a burden that adds more worry. It is truly a gift. The gift of early awareness, of knowing precisely what to look for and when it's time to act. Your hands are incredible instruments. They allow you to connect with the world, to create, to express, and to simply live your life fully. They absolutely deserve your careful attention and your tender care. Remember, having an early conversation with your doctor can dramatically shift your path forward. It can truly mean the difference between effectively managing a condition and facing unnecessary challenges down the line. Please, don't let any worry prevent you from seeking those crucial answers. Knowledge is your strongest ally here, giving you immense power over your own health journey. You truly have the power to protect your hands and continue enjoying a full, active life. Take these insights and use them to empower yourself, to advocate for your well-being. If you found this helpful, you'll definitely want to see our next video, Top 3 foods that fight memory loss, neurologist explains. Tap the card on your screen now to watch it.